All right, let's talk about something that almost all of us, we're talking 85% of people, will deal with at some point: acne. But what is it, really? We're going to get past all the myths today and dive deep into what's actually happening underneath the skin. For being the most common skin condition on the entire planet, it's surrounded by so many myths. Is it about what you eat? Are you not washing your face enough? Well, today we're cutting through all of that noise. We're getting to the real science so you can finally understand the what, the why, and the how of a breakout. Okay, first things first, let's get one thing crystal clear. Acne is not a hygiene problem. It is not some kind of personal failing. It is a legitimate medical condition. And it all starts in a very, very specific place. So here it is, the scientific bullseye. Acne is a disease of the pilosebaceous unit. I know, it sounds super complicated, right? But just picture a tiny little engine in your skin. It's made of a hair follicle and the oil gland that's attached to it. That's it. When that specific engine starts to malfunction, well, that's when you get acne. And this brings us right to the biggest myth we need to bust. If the problem starts deep inside that little skin engine, then scrubbing the surface like crazy isn't the answer. In fact, all that aggressive scrubbing can just irritate the skin and make things worse. The real action, the real story, is happening far, far beneath the surface. So what exactly is going wrong inside that pore? Honestly, the perfect analogy is a traffic jam. It's not just one thing going wrong. It's a specific 4-step pileup that leads directly to a pimple.
This is the chain reaction. It all starts with step 1, an overload of oil, which is also known as sebum. Then, step 2, skin cells that are supposed to shed nice and easily instead get all sticky and they form a plug. So now you've got this blocked pore that's just full of oil, which turns out to be the perfect all-you-can-eat buffet for a normally harmless skin bacteria called C. acnes. And that's step 3, they multiply like crazy. Finally, step 4, your immune system sees this out-of-control party and crashes it, sending in inflammatory cells that cause all the redness and swelling that we recognize as a pimple.
But what pulls the trigger on that first step? Well, hormones are usually the main culprit, especially during puberty. But genetics are a huge factor too. Yep, if your parents had acne, your odds go way up. And on top of that, things like certain medications or even just heavy, pore-clogging products can be enough to set this whole cascade in motion. So that 4-step process can create a few different results on your skin surface. Let's take a quick look at the different types of acne lesions, because knowing what you're looking at is the absolute first step to treating it correctly. Everything starts with these guys, the non-inflammatory lesions we call comedones. You know them as whiteheads and blackheads. A whitehead is just a clogged pore that's sealed shut under the skin. A blockhead is the same exact clog, but it's open to the air. And that black color, it is not dirt. It's just oxidation. Literally the same process that turns a cut apple brown. But when inflammation kicks in, things can get more serious. That simple clog can turn into what we call papules and pustules, basically your typical pimple. But if that inflammation dives deeper into the skin, it can create these large, hard, painful nodules and even cysts. These are the most severe forms, and they carry the highest risk of causing permanent scarring. And this brings up a really common point of confusion: acne versus rosacea. They can look similar, but there's one simple tell. Rosacea causes redness and bumps, for sure, but it doesn't cause kimonos. So if there are no blackheads or whiteheads present, it's very likely not acne vulgaris. Okay, so we've diagnosed the problem. Now, what about the solutions? Well, the good news is that dermatology has a really clear playbook for treating acne, and it's all about using the right tool for the right job. And this is probably the most crucial principle in the whole playbook. You have to match the solution to the problem. An over-the-counter wash that's designed for blackheads isn't going to do a thing for a deep inflammatory cyst. So the first step is always to figure out what you're dealing with. Is it comedonal, inflammatory, or is it cystic? For most mild to moderate cases, the first line of defense is topical therapy, stuff you apply right onto the skin. Remember that 4-step cascade? Well, these treatments target it directly. Retinoids help normalize skin cell turnover to prevent that initial clog. Benzoyl peroxide is excellent at killing off the C. acnes bacteria. And topical antibiotics can help with both the bacteria and the inflammation. But what happens when the inflammation is deeper or the acne is more widespread? Sometimes topicals just aren't enough. That's when doctors move up a level to oral therapies. These are medications you take by mouth, like oral antibiotics, which fight inflammation from the inside out. And for many women whose acne is clearly driven by hormones, there are medications that can address that specific trigger, and that can be a total game changer. And then, for the most severe cases, there's Isotretinoin. Now, this is the heavy hitter. It's incredibly effective, but it is reserved specifically for severe, persistent, nodulocystic acne that's causing scars and just hasn't responded to anything else. It's a powerful tool, for sure, and one that requires close medical supervision. Finally, let's talk about what might be the most important part of any treatment plan, and maybe the hardest: patience. Managing expectations is absolutely critical for success. I want you to remember this number: 6 to 8. 6 to 8 weeks. That's the minimum time you need to give a new therapy before you can tell if it's really working. Skin cells just take time to turn over. There are no instant results. And honestly, the single biggest mistake people make is just giving up way too early. And this is exactly why getting the right treatment and sticking with it is so critical. Untreated severe acne doesn't just go away. It can leave permanent physical scars and those dark spots that can linger for months. And beyond that, we have to acknowledge the very real psychological impact it can have on a person's self-esteem and mental health. So, let's end on this really hopeful and very true note. Acne is a highly treatable condition. The key isn't some secret product, it's a clear understanding. By knowing the cause, identifying the type, and then applying the right treatment with patience, the prognosis is excellent. The goal isn't just about clear skin today, but about preventing the long-term physical and emotional marks it can leave behind. The power truly is in the knowledge.